We all know about traditional cancer treatment: chemotherapy, radiation, toxic methods that kill good cells along with the bad ones. But what if a treatment could help and at the same time avoid harm? What if, by the time someone you know needs cancer treatment, a safe, non-toxic, personalized therapeutic vaccine becomes routine? The new direction in cancer treatment is the use of the natural defense weapons of the immune system. The immune system is very effective in killing bacteria and viruses, which are foreign invaders. The problem with cancer cells is that they are part normal and part mutant invader. Their mutant parts, or tumor antigens, can be attacked by the immune system, while the normal parts activate self-protective systems against the effective immune process. However, there are no self-protective mechanisms for microbes. As you will see in the next video, when tumor antigens are contained in microbe-looking structures, the self-protective mechanisms are ignored, and the immune system can be activated to kill tumor cells.
In this aggregon technology, the power is not only in the fact that the cancer antigen is no longer presented as a cell, but is presented as a microbe. So the response is an antimicrobial response, which is, that's what the immune system is designed for.
We manufacture our anti-cancer vaccine out of a 27,000 square foot facility under strict GMP conditions at all times, providing a safe and reproducible product. As our clinical trials progress, our team of experienced scientists continues to research new types of cancers for our vaccine and to expand access to an even greater number of patients.
We have already indication of efficacy in early clinical trials, in which we demonstrated also the safety.
About 15 years ago, I conducted the first clinical trial with the aggregon technology at the National Cancer Institute. It showed that patients achieved a better than expected disease-free survival. And as seen on this graph, about half of the patients maintained the remissions long beyond the expected relapse dates of 2 to 2.5 years after treatment. In fact, one of the patients is still under observation and has been in continuous complete remission for over 10 years.
In 2000, when I finished all my chemotherapy and I got my vaccine inoculations, I felt my whole life I was a hopeful person. That was 2000. It's now almost 2016 now, and I'm in remission. I'm just so thankful that the vaccine has kept me going. I just hope it's more available to other people to save their lives. It's a godsend.
People have been trying really hard to combat cancer and at all costs to make people live longer. But what about living better?
Get rid of the toxicity is number one priority, because the quality of life, after all, it's very important. You would like to provide a treatment that'll help the patient, but it also gives the individual a certain quality of life.
There was an opportunity to advance a technology that can put people into long-term remission and give them a therapy, an anti-cancer therapy that is non-toxic. It was tremendous. I think that fulfills a major unmet need in the market.
This is a company that has huge potential in the years to come. The immunotherapy to treat cancer, it's relatively new. There are a lot of other companies that create or make vaccines against cancer, but what attracted me at XEME Biopharma was its unique process, the fact that it's affordable and is generated very fast.
Another very important aspect of this cancer vaccine is that it is personalized. It is as personal as you can get. A tumor is taken from the patient. It is transformed then and incorporated into the vaccine. So each individual patient, his immune system is trained with the proteins of their own tumor.
It's like a stealth technology combined with guided missiles. They go exactly where they should go and find the cancer cells and kill them on the spot.
You are you, and your cancer is yours. And this, by taking the tumor from the individual patient and making a personalized vaccine, will ensure that you have the most potent immune response to your type of cancer.
So in addition to being effective in terms of its action. It's also expected to be cost effective given the pricing pressures the US economy is facing with respect to healthcare costs.
Given that we have a non-toxic treatment as well as a cost-effective one is, to me, the most worthy of causes in oncology.
We are actively seeking significantly larger financing to expand our clinical trials. In the meantime, your help is crucial to expand the research process to various forms of cancer. We hope that someday someone you know may benefit from your generosity. For more information about our technology, please stay tuned for a technical video explaining the vaccine's mechanism of action.
The preparation of a personalized therapeutic vaccine begins with the collection of cancer cells from a patient. They are shipped to XEME Biopharma, where the vaccine is manufactured within hours. It is sent back to the clinician to be injected subcutaneously into the same patient. An aggregon is formed by the assembly of lipid membranes, dissolved tumor cells, and human IL-2. Upon closer examination, the onion-like structures of the aggregons are composed of lipid layers that contain the patient's cancer cell antigens and human IL-2, a powerful immunostimulator and well-known anti-cancer agent. Aggregons deliver the benefits of IL-2 locally, without the associated toxicity. Abundant subcutaneous dendritic cells ingest aggregons. The dendritic cells migrate through lymphatic vessels to regional lymph nodes along with free aggregons. Like microbes, aggregons provide powerful danger signals that activate the dendritic cells. These cancer cells are now seen as dangerous microbes and are no longer tolerated. The dendritic cells prepare and present cancer cell antigens to activate T cells. These activated killer T cells multiply under the action of IL-2 that comes naturally from dendritic cells and helper T cells, but also from aggregons. The natural supply of IL-2 is reduced by negative regulatory signals that protect cancer cells, but the multiplication of killer T cells and natural killer cells continues under the effect of IL-2 from aggregons. The synthetic aggregons do not respond to negative signals. These activated killer T cells migrate, recognize, and repeatedly kill cancer cells everywhere they are present. They also become long-lived and robust memory T cells ready for reactivation. When injected again, the cancer cell antigens on aggregons reactivate memory killer T cells, and the IL-2 expands their numbers. They recognize and kill any remaining cancer cells.
For more information, please visit our website at www.xemebiopharma.com.